36 elevated serum alkaline phosphatase, low albumin, elevated calcium rhabdomate have multiple poorly defined sclerotic lesions diagnosis. Prostate carcinoma. 37 hyperglycemia and left-sided chest pain 4 months mass centered on a rib destroying the overlying cortex and associated with a soft tissue mass. Paraneoplastic phenomenon diagnosis. Chondrosarcoma. 38 an incidental abnormality in his distal femur 4 cm well-defined lucent lesion at the lateral margin of the distal end of the femur abutting the articular surface without expansion diagnosis. Giant cell tumor. 39 history of bone pain calcium of 13.2 mg/dl with phos millimeters. Osteitis fibrosis cystica. 40 treatment of achondromyxoid fibroma appearance.
Well-defined lucent lesion with sclerotic rim in the
41 expansal lyric lesion in the right sacral margins were well defined and there was no soft tissue mass visible diagnosis. Giant cell tumor. 42 a 25-year-old man was found to have a giant cell tumor in his tibia. What location in the bone is most typical? Epiphyseal. 43 Paget's disease mixed lytic/sclerotic appearance in the sacrum diagnosis. Osteosarcoma. 44 osteosarcoma of his tibia staging seek small nodule in his left lower lobe. 10 to 20%. 45 nocturnal low back pain salicylate-based medication is particularly helpful most likely diagnosis. Osteoid osteoma. 46 long-standing lower back pain diagnosis of an osteoblastoma over another diagnosis. Location in the posterior elements. 47 left-sided growing pain weight loss. Well circumscribed lesion with a sclerotic border and central radiolucent nidus within the femoral neck diagnosis. Osteoid osteoma. 48 pain in his right knee enlarged and tender lytic lesion in the epiphysis of the distal femur with a soap bubble appearance. Giant cell tumor. 49 double density sign in the femoral neck centralist region of intense activity surrounded by a region of lesser activity most likely cause. Osteoid osteoma. 58 patient with a known area of fibrous dysplasia in their femur subsequently presented with a soft tissue mass in their thigh and an MRI was arranged. The mass was of low signal on T1 and high signal on T2 weighted images and a biopsy showed it to be a myxoma. What is the likely diagnosis? Mazabrowd syndrome. 51 based on age alone, what is the most likely primary bone tumor in a 45-year-old male? Chondrosarcoma. 52 a 15-year-old boy was recently diagnosed with Ewing sarcoma. What is the most likely bone to be affected? Femur. 53 a 14-year-old girl was recently diagnosed with a Ewing sarcoma of her left femur. Which part of the bone is most likely to be affected? Metaphyseal and diaphyseal. 54 aggressive lesion causing a moth-eaten appearance of bone destruction soft tissue mass centered on the distal femur. Diagnosis. Osteogenic sarcoma. 55 fallen fragment within a well-defined unilocular lesion in the proximal humeral metaphysis cortical thinning but no periosteel reaction most likely diagnosis? Simple bone cyst. 56 well-defined lytic lesion with a thin sclerotic margin in the epiphysis of the proximal tibia. MRI, STIR and T2 weighted images demonstrate a high signal, lobulated lesion with a thin low signal margin. Extensive surrounding bone edema. Most likely diagnosis? Chondroblastoma. 57 a 15-year-old patient felt a lump on their hand and a radiograph demonstrated an enchondroma. From which part of the bone do enchondromas develop? Metaphysis. 58 U.S. sacral region solid cystic mass and pelvic X-ray mass with amorphous calcification blood test most helpful diagnosis. Alpha-fetoprotein. 59 renal cell carcinoma treated with a radical nephrectomy bony pain in his lumbar spine increased uptake on a subsequent TC99 MDP bone scan most likely appearance. Expansal, lytic lesion. 60 difficulty walking complex sensory deficit astrocytoma of the spinal cord. Which area is most likely to be involved? Thoracic spine. 61 a 23-year-old man was investigated with an MRI scan for knee symptoms following an injury playing football 4 weeks before. On the sagittal images the posterior cruciate ligament was intact but followed an obviously curved course. What underlying injury is likely? Anterior cruciate ligament tear. 62 where in the body are enchondroma most likely to occur? Metacarpals. 63 at what age is an osteoid osteoma most likely to present? 10 to 30 years. 64 arthritis and generalized osteoporosis enlargement of the metacarpal head and loss of joint space which malignancy is he at highest risk of? Hepatoma. 65 shin pain stress fracture. Which investigation would be most sensitive? Triple phase TC99M methylene diphosphalatonate, MDP, bone scan 66. A 40-year-old woman presented with a long history of a painful joint and was found to have pigmented villonodular synovitis, PVNS. Which joint was most likely to have been affected? Knee. 67 anterior dislocation of his glenohumeral joint associated injury to the glenoid labrum is likely? Bankart lesion. 68 A child with obvious leg length discrepancy was found to have proximal focal femoral deficiency. What other structure, S, is often absent? Patella. 69 premature aging skin and muscles began to atrophy. Perception of the lateral portions of the clavicles and the chest was narrow with thin ribs dyed of A. Myocardial infarction at 29 years likely inheritance of his condition? Autosomal recessive. 70 pain in the left side of their pelvis flake of bone adjacent to the anterior inferior iliac spine on their radiograph muscle. Are they likely to have avulsed? Rectus femoris.
कैल्शियम है पूरी रिफाइनरी लेजन सिक्योरिटी लेजन है पोस्टेड करना इसमें होगा कि एलईडी मेल है ठीक है हाई क्लोराइन फॉस्फेट हाई अल्कलाइन फॉस्फेट मैक्स फॉर्म फॉस्फेट क्लोराइड ग्रेनुलोसिस क्लोराइड मैक्स फॉस्फेट फॉस्फेट मैक्स हाई प्रेगनेंसी में जो होता है ये पारा नियोप्लास्टिक फिनोमेना है ये कॉन्डोसार्कोमा में होता है रिब केज और ये पारा नियोप्लास्टिक फिनोमेना करता है जॉइंट सेल ट्यूमर होते हैं एपर्स आर्टिकुलर सर्फेसेस और विदाउट एक्सपेंशन ठीक है या सब आर्टिकुलर होता है ठीक है ऑस्टियाइटिस फाइब्रोसिस ठीक है ये बोन पेन है कैल्शियम ऑफ 13.2 एंड फॉस्फेट ऑफ 0.6 और सैक्रम में और 19 ईयर ओल्ड बॉय अगर हो और सैक्रम में लेजन हो तो ये भी जॉइंट सेल ट्यूमर है ठीक है जॉइंट सेल ट्यूमर सैक्रम में बना जाता है और जॉइंट सेल ट्यूमर एपिफाइजल है ठीक है आज के ब्लास्टोमा जो होता है ये एलिमेंट्स में होती है ज़्यादातर software myxomas plus fibrous dysplasia plus myxoma is Maslow's syndrome ठीक है 45-year-old male में chondrosarcoma है ठीक है अच्छा यून सार्कोमा को तो MD बन जाता है मेटाफाइजम डाइप्राइजम ठीक है मत इतना पीरियड जो होता है ये ऑस्टियोजेनिक सार्कोमा ठीक है एक्सपेंसिव लेजन जो होता है ये ठीक है posterior depression colon so real cell gangliomatosis expansile and right extension. Astrocytoma is common in thoracic spine. अगर ये curved PCL आ जाए curved PCL ये anterior ligament tear करते हैं ठीक है Again, of the same associated to the labrum is Bankart lesion. ठीक है हिलचाल ये posterior humerus head को डैमेज करता है इसमें impact होती है अच्छा leg distal है तो what other structures absent patella patella is a leg or patella leg distal